Days from now, we will be ushering in a new year. This is traditionally a time of festivity and celebrations. Unfortunately for us here in South Africa, and for others around the world, there is little cause for celebration this year. Yesterday, we passed the mark of more than 1 million confirmed coronavirus cases in our country. Nearly 27,000 South Africans are known to have died from COVID-19. The number of new coronavirus infections is climbing at an alarming and unprecedented rate. More than 50,000 new cases have been reported since Christmas Eve. The majority of new cases are emerging in KwaZulu-Natal, the Western Cape, Gauteng, and the Eastern Cape. Infections are also alarmingly on the rise in Limpopo. Infections are on the rise in part because, as humans, we are social beings and have an inherent need to socialize with one another. We feel the need to visit friends and family. We attend religious services and we go to parties. But this is a time of heightened danger in the face of a rising global pandemic. Across the world, countries are having to take drastic measures to curb the new waves of infections. In a number of other countries, lockdowns are being imposed, even on our own continent in some countries. We will all have heard that there is a new variant of COVID-19 that is now well established in South Africa. Our scientists briefed me the other day together with the minister, and they've been studying this new variant called 501.V2, and they've been studying its spread and its effect. It appears that it may be more contagious than the virus that drove the first wave of infections. The rapid rise in infections is being fueled by so-called super spreader events, including year-end functions, family and social gatherings, and music and cultural events. This is where infections happen most. This is a cause for great alarm and points to an extreme lack of vigilance amongst us over the holiday period. We have simply let our guard down, and unfortunately, we are now paying the price. We have not been wearing our masks. We are not washing our hands or sanitizing, and we are not keeping a safe distance from others. We've continued to host and attend social gatherings and events that in many cases violate the public health regulations. As has been the case previously, social gatherings substantially increase the risk of transmission. Venues are often poorly ventilated where these social gatherings take place, and their permitted capacity is continuously exceeded. Hand sanitizing is not used at all, and masks are worn just to gain entry into the venue, only to be taken off once people are inside. In these same social gatherings, the consumption of alcohol in places like restaurants and nightclubs and taverns has contributed to risky behavior like not wearing masks, because people always take their masks off and they don't observe social distancing once they are under the influence of alcohol. Excessive alcohol consumption is also driving up the number of trauma cases in our hospitals. According to the data that we have, with every relaxation of the restrictions on the sale of alcohol, the number of trauma cases reporting at our hospitals has increased. These trauma cases from bullet wounds, stabbings, motor vehicle accidents, and many others are putting an unnecessary strain on our already stretched public health facilities. Our hospitals, both the private and public hospitals, are already close to full capacity in a number of provinces, and ICU beds are either full already or rapidly filling up. In the Eastern Cape, for example, the number of hospitalizations and in-hospital deaths has now surpassed the numbers witnessed in the first surge earlier this year. Several provinces are hard at work to prepare additional beds, ventilators, and oxygen to respond to this increase. Our frontline healthcare workers, who have put their lives on the line over the past 9 months to care for the ill, are becoming infected themselves in higher numbers. They are exhausted, and they are struggling under the strain of the second wave already. During the month of December, 4,630 public sector health workers contracted COVID-19, bringing the total number infected since the start of the pandemic to over 41,000 health workers. Yesterday, I saw a social media post from a doctor in one of our facilities, which I would like to share with you because in many ways it captures the situation that our health workers are having to face on a daily basis. He writes, "Half our consultants have COVID. More than half my colleagues had COVID or are currently in quarantine. Hospital is full. No oxygen points. Private hospitals are full. Not accepting more patients. No beds anywhere. And this is not yet the peak. Guys," he ends, "we are all going to pay for your inability to be responsible with our lives." Close quote. These brave men and women who have kept our hospitals and clinics open and running through their resilience, courage, and professionalism are now at even greater risk than before. They are themselves almost at break point. They could lose their lives. More families will mourn, all because of our actions and our failure as a people to take responsibility. We are at an extremely dangerous point in our fight against the pandemic. Unless we act now, and unless we act decisively, the number of new infections will far exceed what we experienced during the first wave, and thousands more people will lose their lives. On the recommendation of the National Coronavirus Command Council and after consultation with provinces and our metro mayors, Cabinet met this morning and has decided to put the country on an adjusted level 3 from level 1, with immediate effect from midnight tonight. Several of the level 3 regulations are being strengthened to further limit the potential for transmission, while doing everything possible to keep the economy open. We have adjusted the restrictions that will apply at level 3 based on the lessons that we have learned through our response to date. There are 4 main reasons for this step. Firstly, we want to minimize the risk of super spreader events even further. As the number of people with active infections rises, there is a greater risk of an infected person without symptoms being present in a gathering and spreading the virus. Secondly, we want to decrease unsafe interactions between people. Thirdly, we want to increase the implementation of our 5 key prevention measures, they being social distancing, the wearing of masks, hand hygiene, symptom checking and testing. Fourthly, we want to decrease the burden on healthcare services so that resources can be directed to meet the needs of COVID-19 and other patients. These are the key reasons. Under the adjusted level 3 regulations, all indoor and outdoor gatherings will be prohibited for 14 days from midnight tonight, except for funerals and other limited exceptions as detailed in the regulations such as restaurants, museums, gyms, casinos. These will further be set out by the Minister in regulations and will be reviewed after that period. Funerals may not be attended by more than 50 people with social distancing. Every business premise must determine the maximum number of staff and customers permitted at any one time based on the social distancing guidelines and may not exceed that limit. Coming to curfew. The nationwide curfew will be extended from 9 p.m. to 6 a.m. Apart from permitted workers and for medical and security emergencies, nobody, and that means nobody, is allowed outside their place of residence during curfew. Non-essential establishments, including shops, restaurants, bars, and all cultural venues, must close at 8 p.m. The list of these establishments will be released shortly. We now know that the simplest and most effective way to reduce transmission of the coronavirus is to wear a cloth mask that covers the nose and the mouth whenever in public. Until now, the owners and managers of shops and public buildings, employers and operators of public transport have had a legal responsibility to ensure that everyone entering their premises or vehicle is wearing a mask. But given the grave danger our country now faces, the adjusted level 3 regulations will make every individual, meaning everyone, responsible legally for wearing a mask in public. From now on, it is compulsory for every person to wear a mask in a public space. A person who does not wear a mask covering over their nose and mouth in a public place will be committing an offense. a person who does not wear a mask could be arrested and prosecuted. On conviction, they will be liable to a fine or to imprisonment for a period not exceeding 6 months, or both a fine and imprisonment. I must admit that this is a drastic measure, but it is now necessary to ensure compliance with the most basic of preventative measures. We remain particularly concerned about the elderly and those with comorbidities, that is, with other ailments, and ask that they do their utmost to protect themselves from the virus, especially minimizing their contact with other people. One of the more difficult areas of regulation relates to the sale of alcohol. The liquor industry is a major employer and an important contributor to our economy. Our priority at this time, however, must be to save lives. Reckless behavior due to alcohol intoxication has contributed to increased transmission. Alcohol-related accidents and violence are putting pressure on our hospital emergency units. As we had to in the early days of the lockdown, we now have to flatten the curve to protect the capacity of our healthcare system, to enable it to respond effectively to this new wave of infections. In such a scenario, every piece of medical equipment, every hospital bed, every healthcare worker, and every oxygen tank is needed to save lives. Therefore, under the strengthened regulations, the sale of alcohol from retail outlets and on-site consumption of alcohol will not be permitted. The prohibition on consuming alcohol in public spaces like parks and beaches remains. Distribution and transportation will be prohibited with exceptions that will be explained by the minister. These regulations may be reviewed within the next few weeks if we see a sustained decline in infections and hospital admissions, as we did before. In effect, the adjusted Level 3 regulations will keep the economy open while strengthening measures to reduce transmission. With a few exceptions, businesses may continue to operate as long as all relevant health protocols and social distancing measures are adhered to. Nightclubs and businesses engaged in the sale and transportation of liquor will not be allowed to operate. The Level 3 restrictions will remain in place until the 15th of January 2021. These measures will be reviewed at that time on the basis of the state of the pandemic in our country. When I last addressed you, I indicated that in managing the pandemic, we would follow a differentiated approach that took into account the rise in infections in particular municipalities. Municipalities defined as hotspots will be subject to additional restrictions until there is a clear and sustained decline in infections. Following a review of the latest available data on infections and hospitalizations and consultations with affected provinces, Cabinet has decided that the following further areas be declared coronavirus hotspots. In the Eastern Cape, these are Chris Hani District, Buffalo City, Amatole District, Alfred Nzo district, and the OR Tambo district. These are in addition to Nelson Mandela Bay Metro and the Sarah Baartman district, which have already been declared hotspots. In KwaZulu-Natal, these hotspot areas are eThekwini, Umgungundlovu district, Ugu district, Herigwala district, King Cetshwayo district, and Ilembe district. In Gauteng, the West Rand district, Tshwane, Ekurhuleni, and Johannesburg are declared hotspots as well. In the Western Cape, the West Coast district, Overberg district, Winelands district, Cape Town, Central Karoo district are hotspots. This is in addition to the Garden Route district as well. In the Northwest, Bujanala district is declared a hotspot area. And in Limpopo, the Waterberg district and the Capricorn district are declared coronavirus hotspots. When I last addressed you, we announced that certain beaches in our country would be closed on certain days and others would remain open. As the infections continue to rise, Cabinet, on the advice of the National Coronavirus Command Council, has decided that all beaches, dams, lakes, rivers, public parks, and public swimming pools in hotspot areas will be closed to the public with effect from tomorrow. National and provincial parks and other parks where access control measures and entry limitations are already in place may remain open to the public. Those living in hotspot districts are strongly advised and encouraged to minimize their travel within the district to essential travel so as to minimize contact with other people. Travel to hotspot districts should be avoided by all of us if possible. The stark reality is that every single district in this country has the potential to become a hotspot unless we observe the current preventative measures. As we intensify our efforts to prevent further infections, we continue to work to ensure equitable access to an effective COVID-19 vaccine. As we have reported before, South Africa is part of the global pooled procurement initiative coordinated by COVID-19 Vaccines Global Access Facility, commonly known as COVAX. We can confirm that we have signed off on the agreement with COVAX, and the Solidarity Fund has made the initial payment of 283 million rand to the facility. We are grateful for the support we continue to receive from the Solidarity Fund across all areas of our COVID response. We should remember that the Solidarity Fund is a multi-sectoral funded initiative, having received funding from government, a number of individual South Africans, also from various institutions including political parties, as well as business corporations. We are part of the first group of countries that will receive an allocation of vaccines from COVAX. We have been advised that we should expect the vaccines in our country in the second quarter of 2021. We are also having parallel bilateral discussions with a number of vaccine manufacturers and will make further announcements once firm agreements are in place. As a country, we need to build a strong partnership between the government and business to augment the resources required in financing additional vaccines necessary to achieve herd immunity. Engagement to this effect are at an advanced stage, and we urge the private sector to continue their participation in this endeavor. And we applaud them for having embarked on an initiative that will be beneficial to all South Africans, but announcements in this regard will be made in due course. We are working to secure a sufficient supply of vaccines in the shortest possible time to protect the most vulnerable in our community. Until then, we have no choice but to observe the highest degree of vigilance and to protect ourselves and others in every way that we can. We each have a responsibility to wear our masks, to continue washing our hands and sanitizing them, and to continue keeping a safe distance from others. We must remember that this virus is carried through the air and that we must therefore avoid what has been described as the 3 C's: closed spaces, crowded places, and close contact with others. This virus takes advantage of our overconfidence. Because we feel healthy now, we think we cannot get sick. Because they seem fine, we believe that nothing bad can happen to our loved ones. As older people, we think it is okay. We are healthy, so we can still go to big religious services, to funerals, and socialize with our friends. I had a conversation with a friend who informed me that they have lost up to 5 family members who attended funerals of each other. And a sad, dark cloud has descended on their family. This virus is real. As young people, we may feel strong and invincible and believe that we are immune to becoming infected because we are young and strong. As a result, we let our guard down and we take risks. Many of those who have been infected with the virus or who have lost their friends and family in recent months will tell you how much they regret not taking the precautions that have been so well advertised when they had the chance. We can only weather this storm if we immediately and fundamentally change our behavior and our mindsets. Compliance with the health regulations should not be simply about fearing the wrath of the law. It should not be about reluctant observance or peer pressure. This is about common sense. It is about taking responsibility for our own health and the health of others. It is about protecting our mothers and fathers, our grandparents, our siblings, our children, our neighbors, our friends, our colleagues. Wearing a mask is not about your personal choice or your own appetite for risk. Instead, it is about protecting others. If you wear a mask and the person next to you does not, then you are not protected. If you wear a mask and the person next to you keeps their mask in their pocket, then you are at risk. Only if everyone wears a mask can we protect all of us from infection. By now, each one of us knows someone who has been affected by this pandemic in some way. there is none amongst us who can claim that we have not heard of anyone becoming ill or even dying. This is a crisis that affects all of us. This is about our lives. The sooner we understand that it could very well be us in that ambulance speeding by, or us in that hospital bed, or us being buried at that funeral, the sooner we come to the reality of what we are facing right now. If we do not understand it, or if we didn't understand it before, we should now see just how quickly a situation can change for the worse. This is precisely what we are facing now. Our situation has changed for the worse. The new year is upon us. Our children will soon be going back to school. Places of learning will soon reopen so that they can resume their studies. We will want to get back to work, to earning, and to looking for work. We want our life to resume. We all have plans and hopes and dreams for 2021. Perhaps the greatest of them all is the simplest. We wish for the new year to bring better health, stability, and prosperity for ourselves and our families. We want it to be better than the year that has passed, because it's been a horrible year. It's been a year that has been filled with hardship. This can become our common reality if we return to the spirit of solidarity that we have displayed throughout 2020. We can, and we will, and we must defeat this pandemic. But we can only do so if we all play our part. If we experience any mild symptoms, such as a fever, a dry cough, or a tiredness, the advice is you must isolate yourself immediately and cancel any plans that you might have had. If you have difficulty breathing or shortness of breath, fever, cough, loss of smell or taste, seek medical attention immediately. We've often said that you should download the COVID Alert SA app and get notified if you have been in contact with someone with tests who have tested positive. This app has already notified many thousands of people of their potential exposure to the virus and has prevented further transmission. If you have been exposed, quarantine yourself immediately. I know that most of you have heard of this all before, but I say it again, because it is the only way we can keep ourselves and one another safe. If we all rigorously adhere to the basic precautions, and I beg you all, we will see an immediate decline in the infections and hospital admissions. This New Year's Eve will be different to any we have experienced before. Several South Africans have suggested on social media and in many other platforms that we should celebrate the dawn of the new year in a different way, and I agree with them. They have suggested that instead of parties, let us spend time with those closest to us. I support that. There have been a number of suggestions, as I said, in social media that instead of fireworks, which is the usual way in which we welcome the new year, let us each light a candle. Let us each light a candle in memory of those who have lost their lives, in tribute to those on the front line who are working tirelessly to protect us from harm, in appreciation of the great sacrifices that have been made by all those who have passed on this year, and in the confidence that the year ahead will bring health, will bring peace and hope to our people. I will light a candle at some spot here in Cape Town at exactly midnight on New Year's Eve in memory of those who have lost their lives and in tribute to those who are on the front line working to save our lives and protect us from harm. I also ask you to join me, wherever you are, in this very important symbolic gesture. Let us continue to work as one nation, united and determined. We have done it before, and we can do it again. There will come a day when this pandemic will be over. On that day, we must be able to look one another in the face and say, we gave it all that we had. We each played our part. We worked together as one nation, and we prevailed. May God continue to bless our beautiful country and protect her valuable people. I thank you.